Welcome to TCM Board Formula Series. Today we review San, Frigid Extremities Powder. It belongs to the category Harmonize and Release Constraint. The fastest memory hook is this: cold fingers do not always mean yang collapse. Look for constrained yang and a wiry pulse. By the end, you should recognize the core ingredients, formula hierarchy, pattern picture, major differentials, and modern safety checks. This lesson is for board preparation and professional education. It is not a diagnosis, prescription, or substitute for individualized medical care. Build the formula from its ingredients. Chai-hu releases constrained yang and spreads liver qi. Ji-shi directs qi downward and breaks focal constraint. Bai-shao nourishes blood, preserves yin, and relieves spasm. Ji-gan-cao harmonizes and moderates abdominal pain. On an exam, do not memorize the list as isolated names. Link each ingredient to the treatment strategy. The composition should explain why the formula fits its pattern and why a similar formula does not. Now organize the hierarchy. The chief is Chai-hu. The deputy level is Ji-shi. The assistants are Bai-shao. The envoy role is Ji-gan-cao. Together, the formula releases constrained yang, spreads liver qi, harmonizes liver and spleen, and relieves pain. A useful board habit is to ask what the chief attacks or Tony fees, what the deputies reinforce, and how the assistants control side effects or protect the middle. The target pattern is yang constrained in the interior with liver-spleen disharmonia not true yang collapse. Look for this clinical picture: cold fingers and toes while the trunk may remain warm. Irritability or chest and hypochondriac fullness. Abdominal pain. Diarrhea or tenesmus from liver-spleen disharmony. The tongue is often pale or relatively normal. The pulse is wiry. The board answer comes from the whole pattern, not one symptom. Match the disease mechanism, the treatment strategy, and the tongue and pulse before selecting the formula. Differentiate carefully. Sini tang a true yang collapse with a cold body, profound weakness, and faint pulse. Dang gui sini tang a blood deficiency with cold channels and a fine pulse. Xiao yao san a liver constraint with clearer blood and spleen deficiency. When two formulas seem close, identify the single feature that changes the treatment strategy. Ask whether the presentation is excess or deficiency, hot or cold, exterior or interior, and whether phlegm, dampness, food, blood, or sinking qi is the main driver. Safety is part of formula knowledge. Classical cautions include: do not use this pattern label to delay emergency care for shock, sepsis, vascular compromise, or hypothermia. Use caution in pregnancy, significant bleeding, and severe deficiency. Persistent cold or discolored extremities, severe pain, weakness, or altered consciousness requires urgent evaluation. Modern medication review includes: Ji-gan-cao requires review with diuretics, corticosteroids, digoxin, antihypertensives, and conditions affected by potassium. Formula level evidence is limited. Reconcile every medication and supplement. Use a verified product. Document the complete medication and supplement list, set monitoring parameters, and refer when red flags exceed the scope of routine herbal care. Formula names do not guarantee identical composition or concentration across products. Finish with 5 board pearls. Number 1. 4 herbs. Number 2. Cold extremities with constrained yang. Number 3. Wiry pulse. Number 4. Chai-hu and Ji-shi move the pivot. Number 5. Differentiate from Sini tang. The one-line recall is: cold fingers do not always mean yang collapse. Look for constrained yang and a wiry pulse. Review the ingredient architecture, then practice distinguishing the nearest look-alike formula. This concludes Sine San. Save this lesson for spaced repetition, and always connect board memorization with safe clinical judgment.